Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by High Tech Answers and Healthcare Now Radio, part of the Answers Media Network, and is sponsored by the law offices of Myrick O'Connell. Now here is your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today are Nirav Modi, President and Co-founder of Carium, and Dr. Greg Widener, Chief Medical Officer of Carium. Nirav and Greg, welcome.
Thanks, Matt. I'm glad to be here.
So before we really dive into the main topics of our conversation today, I always like to give my guests a chance to give a little background in terms of who they are and what they do. So Nirav, would you like to kick it off with your background?
Sure. Thanks, Matt. Thanks for having us. So we started Carium about just over 9 months ago, and what we've kind of set our mission up as is to empower the best health and wellness for individuals and to help each person on their health journey. And our fundamental focus is around bringing data, insights, and actions all together into a unified platform that drives a much more collaborative and continual approach to care. Traditionally, care has been very episodic and not really focused around the individual. It's been focused around the enterprise with concessions being made for individuals, and we're really thinking about it in a very different way at Carium. And, my personal background is not in healthcare, but I've been a technologist for many years, and I've had a series of ventures that I've been a part of. And last summer, the co-founding team started thinking about what it is we might want to do and where we might want to apply our skills. And we looked at the healthcare landscape, the opportunity for change, what was going on from a regulatory perspective, as well as from a technology perspective, and thought that it was the right time for us to bring our skills to the healthcare arena and see if we could really make a meaningful difference in the lives of patients and in the form of patient-oriented and patient-focused care.
Hey, great. And Greg, how about you?
Yeah, thanks, Matt. It's great to be here. And so I'm the Chief Medical Officer at Carium, and in that role, I provide leadership and input to guide company and product strategy and lead a team that oversees the clinical content, evidence-based protocols, behavior medicine, and clinical informatics elements of what we build at Carium and how we build it. My background is I've been a practicing internal medicine physician for 24 years, and most recently have been involved at Atrium Health in leadership roles in healthcare technology and care transformation, and in designing new models of care that are decidedly patient-centered, collaborative, and technology-enabled. And all of those key components are what drew me to Carium, and the opportunity to team up with Nirav and a team of really talented business and technology leaders to build a platform that really could enable the types of care models that we envision for the future and for the present was really exciting for me.
So, Greg, I'm going to kind of turn to you first, since as you just said, you're a practicing physician for a long time, and as you're saying, you've transitioned more into this analytics side of things and handling of the data. So, from your perspective as a clinician and a physician, what is the value of the data, and what meanings are you trying to extract from it?
Yeah, I think that's a great question. I think what we've seen over the past couple of years plus has been, the digitization of healthcare through meaningful use and other initiatives that have really allowed enterprises to get better at delivering on the promise of collecting structured data and then using that to risk stratify and provide the right level of care, decision support, et cetera. And I think the next wave that's upon us now is expanding that data set beyond data that's generated and captured by enterprises to patient-generated health data of all forms, so trackers, sensors, wearables, genomics, individual survey data and inputs, social connections and behavior. And now that data set becomes much more robust and can really help us and help patients to generate insights in the fabric of their life, not just when they're in contact with a healthcare enterprise. And that to me is the most exciting piece.
So kind of given all those data points, what is the most important meaning that we're trying to extract from it? And I guess that's maybe somewhat of an artful question, but it's, are there particular areas that need more focus upfront than others?
Yeah, I think it's a great question. And I think what I think we need is there is so much of our healthcare spend that goes to chronic conditions and diseases that are behavior centric. And so the opportunity to help support people in positive health behavior change and to design tooling and data insights to drive that is a real opportunity for us. And so rather than a reactive care for the patient once they're sick, the opportunity to provide individuals, patients, people, consumers, family caregivers with real-time insights that give them an idea of what the next best action is, I think is really where the opportunity is for using data meaningfully in driving the health journey for people.
So, and kind of maybe
I'll
turning
add to that.
Oh yeah, go ahead, Nirav.
Go ahead, Matt.
No, go ahead.
I was going to say, I'll add to that a little bit. If I step back and just look at what we saw from a landscape perspective a year ago as we were thinking about what we thought Carium could be, there's very real near-term benefits of data that Greg has just alluded to in terms of just the ongoing, more continual management of chronic diseases and diseases that are often impacted by just behavior. I think the other part that is very exciting for us, and certainly where I think the industry is headed from an overall trajectory perspective, is the use of data and the use of data and metrics and markers to personalize the care plan and to personalize the medical plan. And by that, I mean, if you look at what's going on with the progression in our ability to understand the human genome and genetics and pharmacogenomics as specific examples of that, and you look at the kinds of data that we're able to collect at a very high degree of accuracy on a very individual level with a remote sensor like a continuous glucose monitor, or even something like a more consumer grade wearable like an Apple Watch or some other Android wearable, we have data that is very uniquely about a given person and their habits and their tendencies as well as their health. And by and large, most of that data is not used by the health systems at large. And it's because the care models are not oriented around being able to take advantage of that data. Incentives are not aligned around being able to use that data effectively and to monitor people on a more ongoing basis. So there is this increasing gap between the instrumentation we have about people and what we're actually doing with that. And I think there's going to be a sea change in terms of how we approach medicine, how we use that data to continually guide and nudge and encourage people to make the right choices. And that's where the behavioral change element comes in. But there's going to be a sea change in the way we think about treating people in a very episodic, come into the office, get some labs done and treat based on that, versus the opportunity to treat somebody on a continuum using data that is uniquely and continually being updated in their context, and using data that is beyond clinical, but it's also socioeconomic and social, like how are you feeling today? Or where have you been? And what has the pollen been like in the areas that you're commuting to, right? Think about a COPD patient coming in for an annual pulmonary test versus being able to see how their asthma is doing as they're traversing a variety of geographies and seasons and weathers, which is possible today, but not being done. That is what gets me very excited about the opportunity ahead of us and what I think data is going to enable, but is currently very, very much underused.
Yeah, no, and I think there's a lot to unpack between what both of you were just talking about. And I'm going to try to do my best to kind of break it into, I think, manageable chunks. And the first piece I want to touch on, which is kind of raised by what you're saying, Nirav, about all of the different types of data being created and that are available through new devices or looking into new areas for collection. And thinking about the devices first, are the data created there reliable? And, I guess regardless of the viewpoint on that, what is a way to ensure that it is meaningful data that can be effectively utilized by the system?
Yeah, I think from my perspective, and I'm not a clinician, I think there's no question that there's value from a trending perspective, even if a specific value is outside of, has some variance and percentage variance from something that is truly clinical grade. Having said that, there are clinical grade FDA approved remote monitoring devices that are providing data that are verified and have great utility in a clinical setting. So I don't think the issue of is the data good or not. I think there can always be bad data, but I don't think that's really the issue at this point. I think even the good data, if we can describe it that way, is not being used. And I'm sure Greg has his perspective, having being a clinician and practicing to this date. So Greg, I'd be curious to hear your thoughts as well.
Yeah, I'd echo what you said, Nirav, and I think the burden of precision and accuracy is really dependent upon the level of decision making and clinical activity that's going on around that particular metric. So if it's a matter of a slight variability in step count from one wearable or tracker to another, that's probably not critical, because really what you're trying to do there is give people the insights and the interaction to promote behavior change and engagement, and you're not making critical life and death clinical decisions based on that 5 or 10% variability in the step count. That's different if you're looking at a blood sugar level or blood pressure. But again, we have devices in that realm that have undergone the appropriate regulatory approvals to the point where, despite the fact that it's generated by a patient, it's still valid and reliable data. And the final piece I'll add to that is a lot of the patient-generated health data that we're using today is replacing self-report data that was the previous gold standard. So saying, well, the step count's not accurate, so we can't use it. I think it's far better to have that data collected in real time and shared by a reasonably reliable device than it is to ask the patient for recall at their 3 or 4 month follow-up visit. So tell me how much you've been exercising. So if the gold standard is retrospective self-report, then we're blowing that out of the water with all of these devices that we're using. And again, depending upon the level of clinical import, I think we have to apply the appropriate lens of the burden of precision. So.
Greg, that's a very good point to raise, and I think it's an angle that isn't necessarily covered very much, which is, as you said, even if the device has some amount of variability to it, it's still much better than trying to rely on recall when a patient actually comes into the office. And for those of you just joining, I'm talking with Nirav Modi and Dr. Greg Widener from Carium. I'm talking about new forms of data and transforming how healthcare can be delivered and how it should be focused. And kind of building off of what we've been talking about in terms of all this new data, I hear both of you talking about both the potentially tremendous value and impact that it can have. Thinking to that next step, how can we get that data effectively into the hands of clinicians and arguably effectively into the hands of the patients, because it's one thing to wear, like an Apple Watch or some other type of fitness tracker, but everyone needs to know what to do with that data. So kind of where do both of you guys see that next step currently, and where is it going? And I'll turn to Nirav first, unless, Greg, you have a preference.
No, go ahead, Nirav.
No, I mean, Matt, I think that's really the question that matters. I think it's a given that remote monitoring, continuous monitoring, whether it's kind of a consumer targeted device or a prescribed remote diagnostic device, I think that's the way of the future. So the question is not, will there be data? The question is, how are we going to make it useful? And what we're doing at Carium is creating a view of data that is not just clinical, but is environmental, it's patient generated. So we're trying to create a holistic view of each individual. And then the real question becomes, what do you do with this data? How do you present it? How do you make it actionable? And to us, that's where we spend a lot of our time. And, Greg can add some color in a minute on kind of the kinds of work his team have been doing from the medical perspective. But the real focus for us is, this data is out there. Let's really focus on making it actionable for the user as well as for the clinic or the care team. And what we're doing in that realm is, through data engines and data science, looking for very known correlations, but also for things that we haven't realized yet. And then providing those insights up to the user. And so, as I think about kind of the life cycle of Carium, there's a data aggregation layer, which allows us to aggregate and compose a profile of a person. And then it's really about analyzing that data. And ultimately, it's about, and not just for Carium, but for anybody, to analyze that data and then to drive actionable insights, not only for the patient, but also to the provider. And what we're doing today, for example, is we're generating snapshot reports that say, hey, look, we have 3 months of glucose readings for this particular diabetes patient. And what we've done is we've been able to generate a summarized report to say, here are the incidences that really matter in the course of the last 3 months. The 99% of days that they were within spec are great, but here are the days that they weren't, and here are some other markers that may have influenced that anomalous event, right? So for the focus has to be on driving actionable insights from the data and not the data itself, because I think it's a given that data is coming, and the real question is, how do you use it? And that's where we spend a lot of our time, and we work hand in hand with clinicians in terms of what part of that data needs to go back into the EMR so it's available at the point of care, what data is better left outside of the EMR, because EMRs today certainly aren't architects that they handle the kinds of volume and the formats that are coming out of a lot of these wearables, where the data is being that it's coming out on a 5-minute or even 5-second basis. So we're working closely with our partners to distill that data down into what matters at the point of care and what matters to different people on the care team, right? The physician, the primary care physician that's seeing the patient after 6 months, they may only want to see a snapshot of what have the anomalous events been. But for example, the diabetes coach or the nutrition counselor may want to see a lot of those readings to see how their sugar is trending relative to food. So, we're being very, very focused around what is the use case for the specific member of the care team, and how do we make sure we're presenting the data to them in the right manner. Greg, I'll let you add some color here too.
Yeah, I think that was well stated, Nirav. And I guess I'll piggyback on the care team concept. I think the recognition that as more sources of data and more of a continuous collaborative paradigm of care delivery evolves, the recognition that there is a team, and the team begins meaningfully with the patient, family, and caregivers who are collecting this data or interacting with tools to help generate some of this data, and that there's a bit of a closed loop there, so they can get insights from the act of collecting data from a digital solution through AI-driven prompts, triggers, alerts, reminders, and that doesn't involve the care team at all, but provides meaningful guidance and GPS style next step approaches for the patient. But then the connection with the care team can be really skill optimized so that you've got whatever member of the care team is appropriate to deal with exceptions and alerts and things that pop up. And whether that's a health coach or a medical assistant or a diabetes educator or an RN, an MD, again, a well-designed digital solution with the right type of data-driven interaction profiles and prompts can really help so that the team knows who, what, when, and where. The patient feels supported and connected on their health journey every day. But the team is involved only if and when needed at the appropriate level of licensure. And I think that's the vision for the future, and that's the kind of digital tools we need to build. And if you're going to build that, you don't start at the enterprise and move down or out. You start at the patient and move in toward the care team. And I think where those two meet is where the magic happens, and that's the space that we're firmly in with Carium. So
Yeah, and obviously, all of those outcomes that both of you are talking about are focused on, as you said, that the overall health of an individual and maintaining health, which arguably means trying to keep those individuals out of an office or out of a facility and not having to have a crisis point. So, and I think this kind of goes back to a statement earlier, which is talking about how this fits into the transition to value-based care. Where do you guys see providers or clinicians standing at the moment? Because from my perspective, I get a very skewed view being in Massachusetts, where the transition is probably further along than in many other places. But kind of what do you guys see in terms of where most clinicians stand, vis-a-vis fee-for-service or value-based care, and what needs to happen to get more down into that value-based care world where the analytics that both of you are talking about become that much more valuable. And Greg, I'll let you kind of lead this one off because I think you can offer that dual perspective of having been the practicing clinician and now being on this solution side.
Yeah, no, thanks, Matt. And I think there's a pretty wide range, as you've correctly identified, in terms of where people are on the journey to value. And I think that we have to recognize that and understand that it is a process, because you have to align the payment and reimbursement models, and then you have to align the care delivery models, and then you have to align the culture and the operational elements and the technology to support those. And that doesn't happen with the stroke of a pen on a contract or with a declaration by a senior leader. That takes time because everything from provider and care team expectations and approaches and workflows to patient expectations and workflows to, again, how you do all of this. There's a significant change management element to that. And so we're seeing that actually play out in very real ways, and the move toward value, as most would agree, is clearly underway. And I think especially in the primary care space, value-based primary care looks and feels very different. And when you're in that space, how you use tools like virtual care and collaborative care platforms and messaging tools and patient-generated data becomes pretty obvious once you align the payment and delivery models. But if you're not there yet, it becomes really challenging to understand how you would layer or bolt on this additional workflow on top of your already overtasked existence as a provider. So I think it's a really important transition, and one that we're obviously paying close attention to, and finding partners to work with that clearly understand and are well on their way, if not already on the path to value-based delivery and value-based primary care.
So, Nirav, do you have any thoughts you want to add on to what Greg just shared?
I think what Greg said comprehensively covers the landscape. I mean, there are people at various ends of the spectrum, Matt. I think there's no question that there is significant activity around moving to a pay-for-value-based approach, and it's going to be a gradual transition. I think outside of the sorts of enterprises that Greg alluded to, if you look at what's going on in the ACO space and Medicare Advantage, those are examples where people are aligned around value and fundamentally incented to keep people well versus treat the episodes. And I think that shift is going to be gradual. That shift is key to that shift is going to be only enabled by different approaches to care and care models, and that's what we're here to serve up and what we believe drives the best outcomes. So that's what we stay very focused around.
Yeah, no, I definitely agree with you. It's as you kind of alluded to, there's a lot of different models within Medicare driving there now, which I think is just being the importance of which is just being underscored by a recent report that I saw suggesting that some practices are now saying Medicare payments are not at that break-even point, but less. So, the quicker you can get into value, the better. And as we're already getting to very close to the end of our time, what I want to do is kick out a final question for each of you to answer, which is, what unexpected, or maybe not unexpected, but what required disruption would each of you predict might happen in the coming year? So Nirav, do you want to kick that one off, and then we'll let Greg close it out?
Yeah, I think the drive, the consumerism as it's generally being called, I think that's just going to continue to amplify, and it's going to be only further accelerated by a lot of the adjacent players moving into healthcare. Just by virtue of them making announcements is enough to create waves. I mean, you look at someone like Apple, just last week or 2 weeks ago, for Apple to come out and publicly say that, if we get this right, Apple is going to be remembered primarily for the impact we've had on health. I mean, that is such a bold statement and telling of where their heads are at and where the industry is headed. So I think that the wave of consumerism, the convenience is king, people wanting to feel empowered, I think that is going to just continue to amplify at an unprecedented rate in 2019.
Great. And Greg?
Yeah, and I agree with what Nirav said, and Matt used the word disruption. And I think, if you look at the consumer movement and then all of the forces, whether it's new primary care models, new digital solutions, new mechanisms for care delivery, new thinking and alignments from payers and employers, and you think about that as it relates to incumbent provider organizations, health systems, I think we're going to start to see care being delivered and offered in ways that is more convenient, less costly, more outcome driven outside the incumbent organizations, and I think that really defines disruption in many ways, and whether this can have the same accelerated path that we've seen disruption in other industries and healthcare remains to be seen. But I think we're really starting to see the forces align around all the key components of what needs to happen for that disruption to occur. And so I think this year and next will be really interesting to see how the various players come together to create and deliver upon new care models and the technologies that support them. And we're excited to be a part of that.
Yeah, and we'll definitely be keeping an eye on that. And as I'd already alluded to, believe it or not, we are out of time. I want to thank my guests, Nirav Modi and Dr. Greg Widener, for a great conversation today.
Thanks, Matt.
Matt, it's been great to be here. We appreciate your having us.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.